Okay. Okay, good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager, and we want to welcome you to our joint City of Corpus Christi, Nueces County COVID-19 press briefing. And so we do these, we have been doing these every day for, I think, over 2 months at this point. And next week, we're going to change the format and do them twice in the week, on Wednesdays and Fridays. And Fridays will primarily focus on our research team from Texas A&M Corpus Christi will be presenting their updated modeling numbers and predictive modeling and forecasts and that type of thing. So on Wednesdays, the mayor, the county judge, Judge Canales, Mayor McComb, myself, and Annette will be here. But 7 days a week, as we have been doing, we're providing information to the community through our website and through media releases. And our website has an interactive dashboard that every day is updated with statistics to include number of tests performed, number of new cases, where are the cases in terms of zip code. We have an interactive map on there. So for the community, and especially for those watching, we know that a lot of people have watched this briefing every day, and there's about 100 people right now logged on to Facebook, and that number will grow probably to 200, 300, 400 before we're done today. We appreciate you watching, and we know that this is important, and we want you to know that the information is still available. And if we need to, we'll come back at any time during the week if there's a major event of sorts. But the information's there. The only thing we're doing is changing the presentation format of it from an online, more to be online, and then we'll be here Wednesdays and Fridays. But we do appreciate you watching. I've said that sometimes at the beginning, at the end, but on this holiday weekend, we want to tell you today that we appreciate you watching, especially the consistent followers. Because we can tell from your comments and your concern that this is important to you, and it's important to your friends and family. And we appreciate you telling the community of the story of how to stay safe with COVID and the facts that we tell you, relating them to the community. So thank you for doing that. And thank you for the media that's here. We have KIII, Chris Six, and the Caller Times have been here consistently. I don't see KIII today, but we got Chris Six and the Caller Times. So thank you for being here today. Today, myself is going to present for a little bit. I'm going to present for a little bit, and then Annette Rodriguez will just do a quick update on mobile testing teams, and then we're going to turn the majority of the time over to Dr. Bird from Texas A&M Corpus Christi. He and Dr. Tussaud, who are here, are the lead researchers for a very big team. It's a pretty big team that every day of the week is updating the modeling and working with numbers and updated models from across the world to help us with the graphs that they present to help the community understand what can happen in the future and what has been happening with COVID cases. So they'll be having most of the time today. Okay, so with that introduction, let's do the update on the statistics. And every day at 4 o'clock, we go back for the past 24 hours and see number of new cases, change in hospital stay, and that type of information. So since yesterday at 4, we have only had, we've had 0 new cases since 4 o'clock yesterday. So you can see our running 7-day chart here, beginning from Sunday. Over the weekend, last weekend, there was 2 and 1. And to some extent, that was because of a low testing. However, today's 0 does include almost 300 tests that were performed. And so today, between the health district, the private commercial labs, hospitals, the National Guard, and other testing sites, in our community, we have information that just under 297 COVID-19 tests were performed, analyzed, and the result is 0. So that's good. You can see some higher numbers in the middle of the week, but we did see some lower 4s, some 6s, and then the weekend. I'm going to show you in a little bit the 7-day running average, and because of these lower numbers and some of the 20s dropping off, it brings our daily average, the rolling 7-day daily average, down to a 4. And it was over 10 just a couple of days ago. So we'll show you that, though, in detail when we get to that. So not too much change elsewhere then. 0 new cases, a total of 260 since we've been counting. There's still 3 deaths in the community that have happened over time. The male-female distribution, 60% of all the cases are from male persons and then 40% female. In recent times, there was a kind of an even distribution of the cases by 9 different age groups, but in recent days, most of them have are falling in 3 age categories. 60% of all cases fall in between the age group of 20 to 50. That's 60% of the cases. And then I talked to you about testing, so 297 tests performed today. That brings our total now over 8,000, so 8,006 since we've been counting, so that's pretty decent for our community. When we look at our donut here, the familiar donut chart, we have 28 persons that have recovered right here. 128, I'm sorry. 128, that number kind of wrapped around, but 128 have recovered, and then 129 active cases. So it's about a 50-50 split. The recovered case a week ago or so there were more recovered than active. And this week, earlier in the week, it was the other way, but we're kind of swinging back to seeing more recovered than active cases, which is what we want. We have 6 people in the hospital. There's no change in that since yesterday. There is a change, though, in the number that are in ICU, intensive care. So yesterday there were 2 in intensive care. Today, an additional person was placed in ICU. So of the 6 in the hospital, 3 are in ICU through today. Okay, and then the locations, so there were no new cases, but the majority of the cases, if you've been following, are in the city of Corpus Christi, obviously, within Nueces County. There are 11 in rural Nueces County is the next biggest number, and then 7 in Port Aransas, 4 in Robstown. These are all the cases active or recovered. 1 in Agua Dulce, 1 in Bishop, 1 in Driscoll, and Petronilla still has 0. Now let's look at the 7-day trending chart. So this chart shows number of tests taken daily. That's the blue bars. And then to see a 7-day running average, right? If you look back at the past 7 days and got a daily average for those past 7 days, our numbers have been going up. It was around 300 yesterday. Today it's 322 is our running 7-day total. You can see the red line continues to kind of go up gently, which is what we want in our community. We want a lot of tests taken, so that 7-day average shows that. And then when we look at the 7-day average on the number of cases and kind of the graph of it, you can see that big spike that was caused a week ago or so, the big increase over here. And that primarily was from 2 institutions, if you will, the beef processing plant and then 2 transitional housing complexes. And so that caused that real big spike. But you can see it's coming back down, which is what we want to see. So our 7-day average is 4 cases per day. And at one point it was about 0.5, about a half a case way back here. And then we had that little bit of an uptick, and then the 2 outbreaks, or 3 if you count the 2 transitional homes. And that caused the big increase. But we're back down to 4. And so we have to be mindful that the virus is still here, still active. There still is no antibodies. There still is no cure for it. What is the other thing they call? Vaccine, sorry. There's no vaccine, there's no cure. Our bodies have no immune system unless you've had it before. So those simple things that Annette, myself, the judge, the mayor, the whole medical community has been telling us we need to remember, especially during this Memorial Day weekend. So that includes keep distance from people. You want some social distance. Keep your hands clean. Keep your dirty hands off your face. Use a face mask if you're out in public. If you're shopping in the grocery store where there's big crowds, wear your face mask. Those things are going to help us keep those numbers low and help keep the community safe. Okay, great. So that's an update on the stats. We're going to have that translated into Spanish, and then I'm going to do just a quick update on our Safe, Fun, Fit initiative that starts tomorrow on the Bayfront.
Buenas tardes, soy el gerente de la ciudad, Peter Zanoni. Estoy muy agradecido de que todos ustedes estén al pendiente de la información. Nos vamos a mover en las siguientes semanas a conferencias de prensa que ya no serán todos los días, sino miércoles y viernes, pero la información continuará a la mano. Ustedes pueden accesar el sitio web de la ciudad donde podrán estar al pendiente de la información todos los días que continuaremos proporcionando. Después de mí va a hablar con ustedes Annette Rodríguez, la directora de Salud Pública, y también los profesores de la Universidad de Texas, Dr. Tissot y Dr. Bird. Les voy a dar las cifras más recientes que indican en las últimas 24 horas no se han reportado casos nuevos confirmados por el coronavirus, haciendo un total de 260 casos. 155 son hombres, 105 son mujeres. La mayoría se encuentra en el rango de edades entre 20 y 50 años. A la fecha se han llevado a cabo 297 pruebas por el virus entre el Distrito de Salud Pública, laboratorios privados y la Guardia Nacional. Son 297 en esta última semana. De los 260 casos, la mayoría son en la ciudad de Corpus Christi, 4 son residentes de Robstown, 7 son residentes de Port Aransas y 11 son residentes de las áreas rurales del condado. 128 de los 260 casos se han recuperado por completo. Tenemos 6 personas en el hospital, 3 están en condición crítica en la unidad de cuidados intensivos, 129 son casos aún activos y a la fecha se reportan 3 fallecimientos. Les invitamos a continuar con las medidas de precaución, de distancia social y otras medidas preventivas como usar mascarillas en la cara, cubrirse la boca, no tocarse la cara, lavarse las manos durante este fin de semana de Memorial, en que celebramos el lunes el Memorial Day. También les vamos a hablar de las actividades de la ciudad para el día de mañana, sábado, con mayor detalle en un momento.
Okay, great, thank you. Okay, then just one quick update. Yesterday we announced here for the first time, and today through our social media and other announcements, the city and others are announcing a launching of a Safe, Fun, Fit initiative along our bayfront. That's going to be tomorrow at 7 o'clock, between 7 and 11. And it's in part because of 2 reasons. One, we want to be a healthy community, but 2, we want to encourage social distancing. And what we notice is that there's a lot of people that utilize that bay frontage from Cole Park all the way down and past Water's Edge, but people were jammed up in the sidewalk and they didn't have the opportunity to be 6 feet apart. They also had to delay. I saw persons delaying to let kind of people get a start. If somebody was on a bike, that it was even more complicated, and persons on strollers or wheelchairs or what have you. So we came up with the idea to close and make a fitness lane in the road, close a portion of Ocean Drive going northbound. And so from Cole Park all the way to Water's Edge, that road is going to be closed. When you take that, and I'll show you, here we go on this map, from Ayers, the edge of Cole Park, down to here will be closed, but this is already closed, so that whole red line is a mile, 1.25, 1 mile, 1.25 of a mile. So if you were to go down, back, and down one more time, that's a 5K for those that like to do 5Ks. So the road is going to be closed on northbound direction only, allowing for a big promenade for people to enjoy that beautiful bay, walk, run, jog, bike, take the kids out. What's going to be happening in these 2 green areas is several places across the country are doing this. We're one of the first to start it, but what we have that others don't have are free fitness classes. So down here on the lawn, if we go back to that other slide, right here, there'll be fitness classes. There's going to be 4 starting at 7:30. Actually 7 o'clock, I'm sorry, will be a walk to run, just teaching people how to stretch and just be ready to begin getting healthier just by walking. And then at 7:45, there'll be a Fit Moves class, a little bit more intense, talking about running, and we'll actually, it's not just going to be talking, it's going to actually be putting people to work. They'll be running and doing some exercises. There'll be a yoga class at 8:30. And then a healthy meals from 10 to 11. We'll have a dietitian talking about how you can cook healthy for these next couple of days. We'll be doing this every Saturday. And then Zumba at 9:30, and that will be in the Islanders Pavilion. So for this week, there's 20 persons per class, and all the slots are filled already. But beginning tomorrow, you can register for next Saturday. The same classes, so walk to run, fit moves, yoga, Zumba, and then that healthy meals. And so you register online, the city's website, or VFit Production is actually the nonprofit we're working with to register persons. Those classes are available. There'll be some music tomorrow. We're going to have a DJ there. And there should be a lot of people out for this. We're not launching it tomorrow. It's like a pre-launch, so this Saturday and next Saturday. And then we're going to actually launch it the first Saturday in June. But it gives you that fitness lane. It gives you free fitness classes. It gives you access to a beautiful part of Corpus Christi that is very unique to Texas and the country. And it's healthy and it's free. And so we want you to come out. We know that we want to stay safe and healthy from COVID, but we need to stay safe and healthy generally as a community, and so this will help us do that. We do have T-shirts that we're going to be unveiling tomorrow. I'm going to show it to you now here. And we'll be selling these down there over time. So be safe. It says Safe, Fun, Fit. That's the initiative name, right? We'll have these T-shirts for sale as well there. We'll have several city council members there tomorrow, including Councilwoman Guajardo. She's signed up for several of the classes. Councilman Roy and his family, and Councilman Barrera, and I think a few other Councilman Molina. I think Councilman Molina is going to be there as well. So we look forward to seeing you tomorrow, and it'll be every Saturday from 7 a.m. to 11 a.m. for the foreseeable future. So come on out, have some fun, let's get fit, and let's stay healthy. Thank you. At this point, we're going to translate, and then Annette is going to just give us a quick update, and then we're going to turn it over to Dr. Bird from Texas A&M Corpus Christi.
En el afán de proporcionar a la comunidad una oportunidad de mantenerse saludables y también mantenerse seguros en esta etapa en la que continuamos cuidándonos en contra del COVID, les anunciamos que el día de mañana estará abierto, mañana sábado 23 de mayo, a partir de las 7 de la mañana hasta las 11 de la mañana, estará abierto un carril o todos los carriles de la calle en la bahía, frente al mar, en nuestra hermosa ciudad de Corpus Christi. Estará disponible una milla con 1.25 millas para que la gente pueda acudir a caminar, a trotar o a ejercitarse. Habíamos visto que anteriormente la gente se acumulaba en la banqueta y para poder darles la oportunidad de ejercitarse teniendo distancia social, se va a disponer de estos carriles, por lo tanto no estarán abiertos a la circulación de automóviles. Esto va a ser desde las 7 a las 11 de la mañana y también habrá clases en las áreas verdes del mapa. Estarán disponibles clases tanto de actividades físicas como también algunas clases de nutrición, así que si usted desea participar de estas clases, por favor regístrese en línea en el sitio web de la ciudad. También habrá una clase de yoga a las 8:30 de la mañana. Esto continuará este sábado y el sábado siguiente con el afán de dar este servicio a la comunidad. Habrá además unas playeras, como ya fueron mostradas, y estarán a la venta mañana sábado. Y también se espera la presencia de algunos de los consejeros de la ciudad.
Thank you. Annette Rodriguez, Health Director. Testing continues in our community. Tomorrow, Saturday, May 23rd, the military testing team will be in Flower Bluff. You can call the 512-883-2400 to make an appointment, or you can go online at the texascovidtest.org. The update on the nursing home testing, so far 11 nursing homes have been tested, and all nursing homes are scheduled to be completed by next Thursday. I'm excited also to share some really good news. By the first week in June, our lab testing capabilities will be increased with an addition of our Panther testing system. This system will increase our current capability by 275 tests per day. The kits needed for the Panther should be shipped out the last week in May from our vendor, and then it takes about a week for validation and proficiency testing. This weekend, we commemorate Memorial Day by remembering those who lost their lives to defend our freedom. Please remember to continue to use the best defense we have against COVID-19, and that is our public health strategies. Defend your space. Practice social distancing of at least 6 feet between you and others, and encourage others to do the same. Defend your orifices. Cover your eyes, nose, and mouth when in public places. Defend your health. Avoid people who are sick, and defend your community. If you are sick, do not go out. Continue basic hygiene practices by washing your hands as often as possible for at least 20 seconds. When planning for your Memorial Day activities, think about harm-reducing efforts. Think of harm-reducing efforts on a spectrum. They are activities that have the potential to cause you to be furthest away from harm ways and other activities that put you much closer to the harm of contracting COVID-19. So here you see this graph, and so the activity with the lowest risk is, of course, going to be if you're at home alone. So, but realistically, we all have to leave our home at some point. We have to go back to work. We have to, go back into the community. So the next one is moderate risk, and that's outdoor activities. So that's low to moderate risk when you're outdoors, like you're jogging or you're going outside with your family for a run. Like the mayor said on Saturday, the city manager said on Saturday, go out with your family and do a jog out there. There's plenty of room to social distance there. So. And then you're going into a higher risk when you start doing like outdoor gatherings where you're having like a closed setting, where you're having like a birthday party and you're outside, but it's kind of a crowded area and you don't really know the individuals next to you. They're not all family members. That's where you're getting into a higher risk for contracting COVID-19. And then the highest risk is going to be when you're indoors and you're having a social gathering. So it's close, tight, you can't do social distancing, everybody's very close to each other, you don't know who they are, and you don't know where they've been. That puts you at the highest risk for contracting COVID-19. So when you're out there, make these decisions thinking about the spectrum from the lowest risk to the highest risk. The main thing is avoid the indoor spaces that bring you within 6 feet of people from outside your household for long periods of time. It is all about density and duration of the contact. When planning activities, choose to meet outside instead of inside. Look at your environment and make a judgment on how you can keep yourself and your loved ones safe. When in public, access the harm reduction risk and practice all available methods to reduce the negative effects of COVID-19. Making good choices in our behaviors will help reduce the spread of the virus. Enjoy your Memorial Day weekend with your family. Enjoy some good outdoor activity with them and stay healthy. Thank you.
Buenas tardes, soy la directora de Salud Pública, Nel Rodríguez. Continúan las pruebas de laboratorio en la comunidad. Mañana sábado 23 de mayo el equipo militar de pruebas estará en Flower Bluff. Si desea hacer una cita, llame por favor al 512-883-2400. 11 casas de retiro se han examinado y para el jueves próximo se habrán examinado ya todas las casas de retiro. Buenas noticias, con un sistema adicional de pruebas aumentará nuestra capacidad a 275 pruebas por día. Esto ocurrirá en aproximadamente 2 semanas por causa del envío del equipo y la validación del mismo. Este fin de semana conmemoramos Memorial Day. Por favor, recuerden usar la mejor defensa en contra de COVID-19, que son nuestras estrategias de salud pública. Distancia social de 6 pies entre usted y otras personas. Cubra ojos, nariz y boca en lugares públicos. Evite gente enferma. Si está enfermo, no salga. Continúe con estas prácticas de higiene a través del fin de semana y les explico algunas de las causas donde hay un riesgo menor, moderado, alto y más alto. El riesgo menor es cuando está en casa solo. El riesgo aumenta cuando sale probablemente con su familia al aire libre. El riesgo aumenta, es más alto cuando está al aire libre en compañía de otras personas a las que no conoce, y el riesgo más alto es en un lugar cerrado donde hay personas que no conoce, que usted no sabe dónde estuvieron, y hay que usar todas las medidas posibles de precaución. Le animamos a que planee sus actividades en el caso de este fin de semana, que sean preferiblemente al aire libre y no interrumpa su lavado de manos, sus otras medidas de seguridad.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the TAMU CC COVID-19 Modeling Task Force. Before I move on to our slides, I just wanted to point out a phenomenon that is interesting and can maybe work against us, which is that the more chances you take with these higher risk activities like indoor gatherings, the more confident you become that you're not going to get COVID-19. But the thing is that that's the more likely, the more of these encounters you have, the more likely you are to contract it. So at the same time you're becoming more confident that you're not going to contract COVID-19, you're actually becoming more likely to contract it. So be aware of that. And that as you start to feel comfortable, that's when you should start to, get concerned. Like I said, we're here on behalf of the COVID-19 Modeling Task Force. I want to point out our website. I know in the past it's been a little bit difficult to locate due to the long nature of it at the university. So we shortened it down to tinyurl.com. TAMU-CC COVID. So hopefully that's a little bit easier to remember. We'll show that again at the end of the presentation. We have a dashboard there and some of additional graphs and different analyses for you to look at. The objectives of the task force, I go over this every week, but I think it's important to reinforce that we're here to address your concerns about COVID-19 and the interventions that are in place to try to stop the spread of COVID-19. We're also here to provide our leaders with the ability to make evidence-based decisions and not just go with their gut, but also go with data and evidence and things that indicate what the safest move would be. Today we're going to switch up the format a little bit compared to previous weeks, and if you didn't realize, we have 3 basic sections. The first section is on case data, where we review some of the data that we saw. Because City Manager Zanoni is quickly becoming a statistical expert, we're not going to review some of the data that he's showing, but we're going to try to touch upon other data. First, we're covering the 12-county coastal bend, not just Nueces County, not just Corpus Christi. I think that's important to emphasize, so our numbers are generally based on the coastal bend. Here are 2 heat maps that you can see of the coastal bend area. On this side, what you see are the number of cases total in the coastal bend area up to today. You can see the hot spot is Nueces County and San Patricio County secondarily, and then it declines from there. One of the reasons why we talk about the cumulative number of cases is because, as Manager Zanoni noted, the only way to have immunity from COVID-19 right now is to become infected and then recover. There's no vaccine in place. So this gives us an idea of how many people in the community are immune at some point. And it's a very small amount, which is the important part. On the other side, in the purple, what we have is the number of active cases. So these are people that haven't been classified as recovered yet and have recently been diagnosed with COVID-19 and confirmed with a test locally. And again, Nueces County is the hot spot for the local area, and then it declines from there, with San Patricio County in a distant second place. So we're going to go right to our comparisons with San Antonio, and this is a per capita comparison of the total number of cases that we've had thus far. So in Bexar County, which is the most populous county where San Antonio is, there's over 90 cases per 100,000 individuals, versus in the coastal bend, we're 2.3 times less at around 55 cases per 100,000 individuals. And so the importance of this comparison is that we like to go to San Antonio to shop, and people in San Antonio like to come here to go to the beach, and we're connected with this community. And it provides a good benchmark against which to compare us and to give us an idea of what to expect when you go to San Antonio, or if you meet up with somebody that's coming in from San Antonio. In terms of fatalities, we've remained low here in the coastal bend area. Bexar County is slightly higher, but again, in both cases, there are obviously many fewer fatalities than there have been cases. Yes? Yeah, I think this one is, okay. I'll try to speak into the microphone as we move forward. Thank you. I also wanted to point out over here on the graph in the orange box, you see a rapid jump in our numbers. This was covered by Manager Zanoni also, but these were the outbreaks that were quantified last week at the meatpacking plant and at the transitional housing facilities. And you can see what an outbreak looks like now. It's a rapid jump in the number of cases that we see. This is a daily new cases comparison between the coastal bend and Bexar County, San Antonio. And the lighter blue line at the top is San Antonio, and the darker blue line is us. And what you can see is right there. That's our peak from last week with those outbreaks. So last week, I was very concerned about whether this was an isolated spike on our radar or whether it was something that was going to continue. And what we can see now is occurring is it looks like it was more of an isolated spike. There may be spikes in the future, but right now we're coming down, and that's good. You can see that in San Antonio also, they've experienced a spike a little bit earlier than we did, and they're going up again. So this relationship, the new cases per day, is different in San Antonio than it is here. And I think that's why it's important to keep track of these patterns and know what's happening. This is a zoomed-in view on the Coastal Bend area where we break out Nueces County in orange from the rest of the Coastal Bend, the other 11 counties in the Coastal Bend in the teal color. The coastal Nueces County has really kind of overshadowed the rest of the Coastal Bend now because of the outbreaks last week, and the majority of the people at the meatpacking plant lived in Corpus Christi. But you can see if you look very closely, there's a little bit of an upward swing in the rest of the Coastal Bend also, and some of those people working at the meatpacking plant and at the transitional housing were living in other parts of the Coastal Bend, which explains that. In the orange box, again, we have those outbreaks represented, those really high numbers, and thankfully this week these numbers have declined from the outbreak condition, but I'm going to show a graph later on that shows that we're not in the clear, and we have the ability to subtract out the outbreak cases and see what the curve looks like then, and it's still going up even if we don't pay attention to the outbreaks. So we're coming down from the outbreaks, but if we don't look at those and just look at the general trend of everybody else in the Coastal Bend that continues to, when they get sick, they call their doctor, they get recommended for a test, that number of people that are testing positive is increasing. The second phase of our presentation each week focuses on cell phone data. The reason why the cell phone data is important is because it allows us to evaluate the effectiveness of interventions that are in place in a way that we really can't do almost any other way. It also is an early indicator of what we might expect to see down the line, because it takes a fair amount of time between when you contract COVID-19 or when you contract the virus that causes COVID-19 and when you actually become symptomatic and then when you actually test positive. So that could be 10 to 14 days between when you become infected and when you actually get your positive result. So that's the usefulness of the cell phone data, and we're going to preface that with the interventions that are in place. And so the first thing is that we have a stay-at-home if you can request. The second is that there is a loosening of restrictions on social gatherings and public gatherings. And so each week that goes by, more and more gatherings are occurring. 3, the schools are closed. That continues to occur. I think this microphone is just amped up today. I noticed when Annette was talking. And so if this catches me, then it's really loud, and if I go away from it, then I think that it gets a little quieter, but we'll do that. All right, good. Okay, so school closures, those are in place. They haven't been lifted yet. Social distancing, we're encouraged to stay 6 feet apart or more is better. And lastly, if you're symptomatic, even if you don't think you have COVID-19, one of my friends this week got sick, and I said, hey, you should call the hotline and get tested. And they said, oh, well, I don't have COVID-19. I said, well, how do you know? And they said, well, I don't have all the symptoms. But I think at this point, it's pretty widely known that I just saw in the newspaper, I think today, that 35% of all people, as estimated by the CDC, don't show any symptoms. So any symptom that you have that resembles a cold or a flu indicates that it might be COVID, and you should get tested for that. And you should self-isolate until you either know you don't have COVID-19 or until you know you're no longer infectious. So how does the cell phone data reflect upon these types of data? This week we have some new cell phone metrics for you. The first one is how much foot traffic do we see at the schools? And you might say, well, the schools are closed and we're not going to see a lot of foot traffic, and we don't. And that's the exciting part, that the cell phone metric seems to actually work. And so this data comes from safegraph.com. It includes all schools in the Coastal Bend area, not just K through 12, not just junior colleges and community colleges, also universities, so all the way through. And while we're combining them together, I can assure you that all three of them look almost exactly the same in terms of the amount of activity that's there. Now, you might be wondering, how come it doesn't go down to 0? Well, some people still have to go to the schools. There's still some people at the university. The buildings have to be maintained. In elementary schools and K through 12, there's meals still being served sporadically to students in need. And so there's still going to be some activity at the schools. It doesn't go to 0, but it comes pretty darn close. And so the way this works is that if a cell phone pretty much goes onto the property of the school, it gets counted as activity or foot traffic. And you can see that it's way down from 100 is our benchmark that we use in these social distancing cell phone metrics. So 100 means normal. This was the average activity that was occurring before COVID-19 and before we changed our behavior. And you can see the precipitous decline and then pretty much a flat line down at the bottom of just the basic infrastructure that needs to be there in place and support to keep the buildings going and make sure they don't fall into disrepair. So what we're going to do is we're going to add on to this now. So we're going from schools, we keep the schools, and we're going to add hotels. The reason why we're adding hotels is we want to have some idea of how our tourism industry is doing and how many people are coming in from outside relative to before. And I think that this is super cool, the way that this looks. Again, it's a foot traffic model where if a device goes near a hotel, pretty much onto the premises, or resides there for a while, then that's considered hotel traffic. Now, immediately what you notice is this spike. And what that is spring break. And so right at the beginning of spring break, it was right at the time that we were really becoming aware of COVID. And so there was a brief spike in the hotel traffic before it rapidly declined that same week of spring break. And then since that time, right about at Easter was the low point, and most of these cell phone metrics bottom out at Easter. And then from Easter forward, they start to increase. And so what you want to pay attention to here is how low did it go? And that's what was happening at the height of our stay-at-home and social distancing. And when we were at our most vigilant, before we had cabin fever, before we were tired of staying at home, and then seeing how far back towards normal are we. And there we're a little bit more than halfway back to what normal was. Now we might expect this to go well above normal because we all know in the summer, that's really when the tourism industry kicks in here in the Coastal Bend area. We love our winter Texans, but there's not as many of them as there are the people that come down in the summer. And so when this metric goes up above 100, and if we go back to something resembling normal in the summertime, it will go well above 100, and we'll have some idea of how many people are coming in from the outside. The third one we're going to look at is leaving home. What proportion of people are leaving home? This one is based upon if your device stays at home, then it's counted as you stayed at home for that day, or that device stayed at home for that day. If the device leaves home, then that's counted as having left home. And what you can see is that overall this has declined the least compared to the other two metrics. I myself, in my own life, can think about how I walk my dog every day, and I'm guessing that that counts as leaving home. So these metrics aren't perfect. We can do our best to try to filter out activity like that, but in the end, there's nothing that's going to be perfect, which is why we look at a number of these different metrics. And so again, the important thing here is not really how low it went, but the important thing is how close back to normal are we. And what you can see is that at the height of our social distancing right here, compared to now, we're still about halfway in stay-at-home mode. There's people that are still staying at home. I know that outside of walking my dog, I tend to stay at home and don't go out as much as I would have if this wasn't occurring. And so there's several other people that are doing that also, a fairly good proportion. Maybe around 50% of the people that were staying at home now are out and about again and more often leaving home. And then we're going to finish off with the metric that we've been presenting for the past several weeks, which is the encounter index. That's here in blue. So you can see that coming into the graph. And this is measuring how often do two cell phones come close enough for long enough that there becomes a high probability of there being contact or less than 6 feet difference between the people that have those devices. And this has bottomed out right around Easter was its low point, and now it's increasing. Last weekend and the weekend before, it was right around 100 or even above for those particular days. Saturday is the day with the most encounters, but on average, we're kind of at about 75% of what the normal rate was. And there's even a little bit of a downturn now, but probably by next week that will level off or be curving up again. So overall, across all these cell phone metrics, what we see is a general pattern, except for the schools, of going down and then coming back up. And the important thing is that as these metrics start increasing, the probability of transmitting COVID-19 increases. And so there's a direct relationship between these cell phone metrics and the probability of transmitting COVID-19 if you have it, or contracting it if you don't have it yet. And that's why we want to track it. And so this is one of the things that we look at to say, well, we're probably going to continue to see an increase in the number of cases. Okay, the third section of the talk each week is talking about our model estimates and predictions that can be made from those. So the first thing we always talk about is the transmission ratio, and the transmission rate, which those cell phone metrics tell us a little bit about and how it's changing. Now, what 2.8 represents is our best estimate in South Texas of what the transmission rate of COVID-19 is without any interventions in place. If all those cell phone metrics are up at 100 or even above, that's when we're at 2.8. And the way this works is that if you start with one person that's infected within a week, they'll on average infect 3 additional people. Some people will infect 3, a couple people will infect 2. That's how we get a 2.8. Then after 2 weeks, those 3 people infect another 8 people. Then those 8 people infect another 22 people a week after that. And the week after that, those 22 people infect another 61 people for a grand total of 95 people infected in 1 month. This number has been changing somewhat because we've shifted from estimating it for all of Texas to estimating it for South Texas, which is from here to Laredo and south to the border. And as we get more data, this model is parameterized off of fatalities. As there's more fatality data, the estimates should improve. And that's why it changes from week to week, because we have more data with which to estimate it. Now, what's really important is not this is very important, but even more important to us right now is what the actual transmission rate is. And so our estimate is somewhere between 1.3 and 1.6. Now, in previous weeks, I've just given a single value, but this week we have 2 independent estimates of these values. The same one that we've been giving the whole time, and that estimate is 1.3. It's based upon the fatality data, but also an estimate of 1.6 based upon our case data, the number of positive cases. So we're using a different model, and the transmission rate that corresponds the best with our case data is 1.6. In a situation where the transmission rate is 1.6, we go from this sort of scenario with 95 people infected after a month to a scenario where 17 people are infected from 1. Now, this is a lot better than 95, but if you notice, this number is increasing week after week for us, the number for going from 1 to how many are infected at the end of the month. And the previous number is decreasing slightly, but the one that is really about what's happening now is this number. So very importantly, the more people there are that have COVID-19, the more additional people that they can affect. And it's not an additive thing, it's an exponential thing. And so that's why it's important to keep the number of cases as low as possible and do what we can to prevent the transmission of COVID-19 and try to keep it low. We witnessed last week how there can be a few isolated outbreaks, and all of a sudden there's a lot of people with COVID-19 compared to normal. And so it can happen fairly quickly. It was at 1.4. Yep. So moving forward, this is a new graph, and this is showing 2 things. 1, it's showing how did we arrive at this 1.6, and 2, it's showing what would the case data look like, the new cases per day, look like if we didn't count the people that were in the outbreaks. And there's some reasons to do this. We're not trying to make the numbers look artificially low, but it's very important to be able to fit the shape of the natural curve of the increase in the number of cases for us to get an accurate estimate of what's occurring. Now, what you see here is our stay-at-home scenario, and what we've done this week is we figured out at Easter pretty much stay-at-home transitioned from decreasing COVID-19 to us having an increase in COVID-19 even under stay-at-home. So from Easter forward, that occurred. So what we did here was we carried the conditions, the transmission rate that we estimate was happening from Easter to the end of the stay-at-home period. We just carried it forward, and that's the green line here. What you can see is the green line doesn't fit the actual data, which is in black. And this actual data has the outbreaks removed. You can see that it's still going up. So this is not a good fit for the data. So our model that predicts here's what would happen during stay-at-home doesn't fit the data very well. So we say, okay, that's not the right one. Then we go to the other extreme. We look at the model where we just open up Texas completely on May 1st, but continue to social distance, continue closing schools, continue to isolate when symptomatic. You can see there's a lot better fit of the red line to the black line here. Again, it's the same data. The black points are the same. The black line is the same. The only difference here is the model, which is the red line, and how it fits to that data. But you can see it actually is kind of overshooting the best fit line to the data a little bit. And this is where we come to the Goldilocks model right here, which estimates at a transmission rate of 1.6. We have an extremely good fit to the data with the model. And one thing I want to point out here is that what we're comparing in the color with the model is the number of new infections per day. That's going to precede the number of new cases per day, which is the black. So the black is going off of that, the numbers on that axis. The color is going off the numbers on this axis. There's going to be more actual infections than cases, and you become infected sooner than you become an actual confirmed case. So we had to make an offset of about 10 days, which is exactly the amount of time I've been saying week after week that there is between when you become infected and when you're going to show up as a statistic having COVID-19. And within this scenario, we have a very nice match. Now, what are we going to do with this model? One, we estimated the transmission rate of 1.6. Two, we can look at the projected number of hospitalizations moving forward. So the model was calibrated on the number of new cases. Now, we're going to apply it to the number of hospitalizations and see how it performs. Again, what we have here in the black dots, these are the actual numbers of people that were in the hospital day by day by day in the Coastal Bend area that had tested positive for COVID-19. Now, for example, we have a number right here that's probably 15. Now, that doesn't mean that there were 15 new cases on that day. It means that there were 15 people that were already admitted or were admitted that day. They may have also been discharged that day. They still count. So that's what each of these black points represents day by day. We get this data directly from the different hospitals in the area. And the model is the blue line with the blue ribbon around it with the error bars, if you will, or the error ribbon. And what you can see is that in the last couple weeks, we have a very good fit of the model to the number of hospitalizations, which is confidence inspiring. We're not as concerned back here where the fit isn't quite as good. What was happening is we're underestimating the number of hospitalizations early on and with the model that I'm presenting today. But that's representing that there's a change in what it means to test positive, and each of these points meant something different on April 12th than it does now on May 20th. And so the important thing is that we're fitting the data very well in the last few weeks and presently, and the prediction is that we're going to see an increase in the number of hospitalizations. The ribbon represents the low expectation and the high expectation, and the line represents the average expectation returned by the model right now. And what we're hoping is that this is an overestimate, but to the best of our ability, we do not predict that the number of hospitalizations will decline, but we hope that they do. Just to remind everybody that the axis here, we are going from 0 to 60, so right about at June 14th, We're estimating that there might be 60 people in the hospital based upon this model. We're projecting that. It's well within the capacity that we have for additional COVID-19 patients in the Coastal Bend area. And again, we're not sure if that's what's going to happen. Let's see the testing data and the meaning of each positive case is changing as we perform new tests, more tests, as we test nursing homes, as we test different people in the Coastal Bend area. The nursing homes were included in this model and the analysis. We didn't pull those out. So in summary, the new cases in the Coastal Bend, while they're coming down from the outbreak peak, they're actually still rising on about the same trajectory we were before the outbreaks. So the outbreaks, they drove higher case numbers last week, but just because you see all the models turning down, it doesn't mean that overall we're on a downward trend and expect to go down lower than before the outbreaks. We expect to land at a higher place than where we were before the outbreaks right now. Second, COVID-19 is spreading in South Texas. All of the data and evidence that we're looking at suggests this. Cell phone data, fatality data, epidemiological models, they're all projecting that we're increasing. This number, the transmission rate, if it's at 1, we have the same number of people infected constantly through time. If you go below 1, then we have COVID-19 burning out. We were there not more than about a month ago. But if it's above 1, then it's expanding. And even if it's a very small number above 1, eventually if enough people have COVID-19, then the numbers of people can increase exponentially. So the hospitals are presently well within capacity. And I think that everybody should know that we communicate fairly often with local medical and health officials at the hospitals, as well as Director Annette. And so if we see something occurring, we let them know as soon as possible, and they're sharing data with us so that we can do the best we can to project what's going to happen. Lastly, it seems that the fatalities should not rise more quickly in the near future. This talking point was based upon a slide that I removed, and I forgot to remove the talking point, but that should, give you some confidence. The fatalities in the Coastal Bend haven't increased recently, and we don't expect there to be any huge increases in them in the near future. It's important to contain local outbreaks. So we're wrapping up here, and I want to emphasize again that there's no shame in having an outbreak at your company or at your place of business. It's very important that if this is occurring, that everybody get tested. It shouldn't be hidden. Just because a statistic is hidden doesn't mean that that's one less person in the hospital, and I think that's something that's important to realize. I think that the companies thus far that have been involved with the outbreaks should be commended for how rapidly they complied and responded and got everybody tested. And the reason why that's so important is because what happened was Annette didn't get a lot of sleep for the past several weeks, because what she's been doing, and her team, is tracking down where did everybody go that tested positive for COVID, and then potentially testing some of those people that they're tracking down. It kind of spreads out on all the different places that were touched by the meatpacking plant and transitional housing outbreaks. So it's very important to do that so that the outbreak can be contained, and comprehensive testing can be done to stop that outbreak from triggering other increased cases in the Coastal Bend area. And there's a lesson here for managers, and that's that if you don't find the loopholes in your social distancing policies, COVID-19 will. And so it's very important that you don't become more confident as time goes on and nothing happens. If anything, you need to become more vigilant as time goes on, because the probability of contracting COVID-19 increases through time. It doesn't decrease through time right now. Finishing up, what can each of us do? We're not all managers. We don't all control social distancing policies, but each of us can make a difference. If you put on a face covering, that helps a lot. There's a lot of different face coverings right now. They have different levels of effectiveness, but something's better than nothing. So anything you can get your hands on is going to be helpful. This prevents you from transmitting the virus if, say, you're asymptomatic. Say you have the SARS-CoV-2 virus, which causes the symptoms that are known as COVID-19, but you don't actually have the symptoms of COVID-19. You're still contagious. You can still infect other people. And this is probably the single most important reason why it's so hard to contain COVID-19 is that there's so many people out there that are contagious that don't know that they're contagious. So wearing a face mask helps prevent transmission. Also, if you don't have COVID-19, wearing a face mask helps you not contract COVID-19 if you're not immune to it. I know that a lot of people think that they're healthy, but it's funny how you forget maybe the pre-existing conditions that each of you may have that would predispose you to more severe effects of COVID-19. I know that, say, some people in my family, I remember when they were young, they had asthma, and now they don't. Well, if you contract COVID-19 and have a really severe case, that's known as somebody who had a pre-existing condition that made them more susceptible to the negative effects. And when you break it down, a lot of us have these pre-existing conditions that make us more susceptible. I, for one, don't want to find out whether I'm going to have a mild reaction or a major one. Self-isolate when symptomatic so you don't transmit. Stay at home if you can so you don't increase your probability of contracting COVID-19. Postpone social gatherings if you can, or have them online, or do them in a responsible way where you're minimizing the transmission. We're wrapping up here. One thing I just want to point out, I've been going out and looking at what's happening in the Coastal Bend area sporadically, and I've driven down the beach on the island from Whitecap down to Bob Hall Pier. A couple weeks ago, maybe 3 weeks ago, I counted 5 parties. Last weekend, I counted 40 parties in the same stretch of beach, and not one person was wearing a mask the whole time. Now, here's the thing. Are you less likely to contract COVID when you're outside? Sure. But think about the cooler. Everybody's going to the cooler and grabbing a beer, grabbing food out of the cooler, so everybody's touching that. People are maybe sitting in the same chairs and switching as they go. Also, it is possible to contract COVID directly from another person through the air outside if you're close enough or if the wind's in the right direction. And so it's something that you want to think about if you're out there at the beach. Try to be as responsible as you can. And everybody should support additional testing and contact tracing to help contain COVID-19 and the outbreaks that we had last week. Once again, our university URL for the COVID-19 task force is tinyurl.com, tamucc-covid, and you can find a dashboard there and a lot of interesting information. And with that, I'd like to acknowledge all the people that go into making this presentation each week. And I want to thank everybody for being here with us this evening.
Okay, we're going to translate that entire thing into Spanish. No, I'm just joking. Sorry, it was just a joke. Okay, Dr. Bird, that was great. That's one of the best presentations I've seen so far. I didn't get a chance to pre-brief it with you today because of other engagements, but thank you. I think that was one of the best ones. And thanks for shortening that website up. I myself had a hard time getting to it last week, so we appreciate that. There was some good comments on Facebook, and hopefully some of the community was watching and other means as well today. Okay, do we have any questions from the media on regular topics? No, I think we're good. Chris Six, we're good? Okay, great. Well, that concludes our briefing for today. We want to encourage you to stay safe. Remember some of the stuff Dr. Bird, myself, and Annette Rodriguez told you. We're going to be back here Wednesday at 5 o'clock, but between now and then, we'll be posting live updates to our website at about 4 or 5 o'clock or so over the next days, every day until Wednesday and including Wednesday. Okay, we'll see you all tomorrow at the Bay, Safe, Fun, Fit, between 7 and 11. Thank you.